Hey there, limpers. It's Bill, the knee pain guru. It is, what do we got? Today we're going to talk about range of motion issues after knee surgery, specifically ACL reconstruction. I had a call with a guy today. Oh, let me preface this. I'm in a mood today, so odds are there'll be some adult language used at some point in time. So if you're not in the mood to hear anything racy, then don't watch. Today we're going to talk about issues with pain and range of motion after knee surgery, specifically ACL reconstruction. I had a call today with Orlando out of Florida. That was the guy's name. And he had a ACL tear as well as a bucket handle tear in the meniscus of his left knee. And this was in December of 2016. They sewed up the bucket handle tear. They replaced the ligament with a cadaver, which was, a dead body. They reconstructed the ligament in his left knee. And he still had problems with the knee. They had him go to physical therapy. The knee was locking up. They didn't know if it was because of scar tissue or whatever it was. They did two manipulations under anesthesia. For those that aren't familiar, it's basically they put you unconscious and then bend the knee to the extent, so they'll basically put you like in a surgery, but the surgeon will bend the knee to the extent where they'll break down scar tissue. You usually wake up in a lot of pain because of the knee doesn't want to bend that way. So anyhow, it's like it just kind of baffles the shit out of me that this is the mentality of the medical model. Like there's this total fucking disconnect with how the body actually works. Now, ACL reconstruction, taking care of the meniscus, I'm all for it. Medical model is the best, like the Western medical model is the best when something is broken or torn. But if you're looking at lack of range of motion and pain and things like that, there is a fundamental disconnect in how the medical model, physical therapy, doctors approach this. And there's some sort of mentality, like if we force the body, if the body's in pain, if the body's not working a certain way, and somehow if we force the joint to do something it doesn't want to do, somehow it's going to do it. It doesn't work that way. Think of it. It doesn't work in relationships. It doesn't work in anywhere else in life. If you force something to do that it doesn't, force something to do something that it doesn't want to do, it's not going to work. So somehow they think it doesn't apply to the body. So Orlando reaches out to me, wants to talk about it. And I'm like, okay, well, what's happening? Why? He doesn't know why his knee's not bending. He'll do an x-ray, a CT scan, an MRI. The knee's going to look normal. Everything will be fine. The knee's not bending. The knee hurts. Doctors can't answer the question. Physical therapy is trying to push him through it. And it just creates more pain. So now he's limping. He's got pain in his hips and lower back because the body's compensating. He walks like an old man. He's hunched over, like all this stuff because the body is continuing to be forced to do something it doesn't want to do. And it baffles the absolute shit out of me why this mentality is like that. So anyhow, why is it doing that? I told Orlando, have you ever heard of the pucker factor? He said, no. I said, your body's basically saying, oh shit. Your body is basically tensing up because it doesn't feel safe. And that's why the knee doesn't want to bend. No matter how much you force it, the knee's still not going to feel safe. The body's not going to be able to bend the knee. And it's just going to create more pain. So this sets up the conditions for the joint to become dehydrated, for arthritis to set in. The joint begins to wear, so then it gets bone on bone, and now you're a perfect candidate for a knee replacement surgery when you're old enough. Anyhow, I basically broke it down to Orlando that what you need to do is you need to get the pressure off of the nerves. The reason why the body doesn't feel safe is because it's in pain. First and foremost, you get the knee comfortable. When the knee gets comfortable, it relaxes. What have we just done when the knee joint relaxes? We've created more space. It's like simple. Like in concept, it's simple. But the difference is we're switching from a dysfunctional model that doesn't understand, that only looks at anatomy and physiology in the body, to an element and component of feeling in the body. The body feels pain. You don't see pain on an X-ray, a CT scan, or an MRI. It's apples and oranges different. So the point of it is we need to create comfort in the knee. As the joint relaxes, we get another experience of like what we need to create comfort and comfort and comfort. And it leads the body out of pain. What's happening in the meantime? The pain is reduced in the knee. The body neurologically changes states from a sympathetic to a parasympathetic state, and the range of motion increases, which is what Orlando wants to create in his knee. In the meantime, as we reduce pain in the body, we get more of a sense of what else is painful. Hips, lower back, hamstrings, quads, shins, calves, ankles, feet, and we start dealing with those. Well, we have to create comfort with what's screaming the loudest. So I wanted to share that, want to get off my chest because it just frustrates me because it doesn't matter what the diagnosis is. It could be, pain after ACL reconstruction or knee surgery. It could be arthritis. It could be chondromalacia. It could be patellotendinitis, patellofemoral syndrome, Baker cyst. It doesn't matter what the diagnosis is. The fundamental reason why the issue is being expressed in the knee, the nervous system is expressing in the knee, is because of pain. We address the pain, we get the pressure off of the nerves, sets up the conditions for the body to be able to reorganize itself, to heal itself. Got to create comfort first and foremost. You like this video, give it a thumbs up, like my channel, share it with your friends, all the people that you see limping around that are moving like they're old people, older than their age. Share it with them. I got a program starting up March 5th. That's the next Quit Your Quack 6-week program. If you aren't ready to jump into one of my programs, go over to my website, thekneepainguru.com. Take my 7-day knee pain reduction challenge. Start getting in relief in your knee. No cost or obligation to you. If it works, great. We'll have more conversations and I have stuff to help you. If not, then you go on your way and say, this didn't work. So I'm going to wrap it up for today. This is Bill Paravano, the Knee Pain Guru. Going to wrap it up. Have a good day, and I'll see you tomorrow on the next one.